Sarcoidosis is an inflammatory disease. Look at this picture, shows that chest X-ray, CT findings. Look at this. Detail going on. Introduction. Sarcoidosis is a systemic inflammatory disease characterized by the formation of non-caseating granulomas in multiple organs. It most commonly affects the lungs and lymph nodes, but can involve almost any organ system. The condition was first described in the late 19th century and remains enigmatic due to its unclear etiology. Definition. Sarcoidosis is a systemic inflammatory disease of unknown cause characterized by the formation of non-caseating granulomas in multiple organs, most commonly the lungs and lymph nodes. It can present with wide range of symptoms from mild fatigue and cough to severe organ dysfunction and requires a tailored multidisciplinary approach for diagnosis and management. Types. 1. Acute sarcoidosis. Sudden onset, often resolves spontaneously. Example: Lofgren syndrome, triad of erythema nodosum, bilateral hilar lymphadenopathy, and arthritis. To chronic sarcoidosis, gradual onset, prolonged course, causes significant organ damage. 3. Organ specific sarcoidosis. A. Pulmonary sarcoidosis, most common, involves lungs and intrathoracic lymph nodes. B. Cardiac sarcoidosis, lead to arrhythmias or heart failure. C. Cutaneous sarcoidosis, cause skin manifestation like lupus erythematosus. C. Ocular sarcoidosis, affects the eyes, leading to uveitis or conjunctivitis. E. Neurosarcoidosis, impact the nervous system. Causes. The exact cause of sarcoidosis is unknown, but it is believed to result from an exaggerated immune response to environmental or infectious antigens in genetically susceptible individuals. Triggers may include 1. Infectious agents. Mycobacterium, Propionibacterium, or certain viruses. 2. Environmental factors. Exposure to mold, dust, or chemicals. 3. Autoimmune mechanisms. Abnormal immune activity targeting the body's tissues. Risk factors. 1. Age commonly occurs between 20 to 40 years. 2. Gender slightly more prevalent in women. 3. Race higher incidence in African American and Northern Europeans. 4. Genetics. Family history of sarcoidosis increased risk. 5. Environmental or occupational exposure, contact with beryllium, insecticides or organic dust. Complications. 1. Pulmonary fibrosis, scarring of lung tissues leading to respiratory failure. 2. Hypercalcemia, elevated calcium levels due to granulomase producing calcitrol. 3. Organ failure, involvement of heart, liver, or kidneys. 4. Neurological issues, peripheral neuropathy, seizures. 5. Psychological impact, anxiety, depression due to chronic illness. Pathophysiology. Sarcoidosis develops due to an exaggerated immune response, leading to the formation of non-hygienic granulomas in affected tissues. Here is the detailed step-by-step process. 1. Trigger initiation, exposure to antigen, genetic predisposition. 2. Antigen presentation, antigen presenting cells. 3. Activation of CD4 plus T cells, T helper cells, differentiation. 4. Formation of granulomas, macrophage activation, granuloma structure. 5. Cytokine and hemokine cascade, pro-inflammatory mediators. 6. Disruption of tissue function, granuloma persistence. 7. Organ specific manifestations, lungs, lymph nodes, other organs, 8. Chronic inflammation and fibrosis. Fibroblast activation. Progression to organ failure. This step-by-step processes underpins the systemic nature of sarcoidosis and its potential for multi-organ involvement. Signs and symptoms. 1. General fatigue, weight loss, fever, night sweats. 2. Respiratory, dry cough, dyspnea, chest pain. 3. Skin, erythema, nodosum, lupus, pernio. 4. Eyes, redness, pain, photophobia, blurred vision. 5. Heart, palpitations, arrhythmias, heart failure. 6. Neurological, headache, cranial nerve palsies, seizures. 7. Lymphatic, enlarged lymph nodes. Diagnosis. 1. Clinical evaluation, history and physical examination. 2. Imaging. A. Chest X-ray, bilateral hilar lymphadenopathy. B. CT scan, lung involvement. 3. Biopsy, confirm non-caseating granulomas. 4. Laboratory test, elevated serum ACE levels, hypercalcemia, hypercalciuria. 5. Pulmonary function test, restrictive lung pattern. 6. Gallium scan detects granulomatous inflammation. 7. Exclusion of other diseases, rule out infections, malignancies and autoimmune conditions. Nursing diagnosis. 1. Impaired gas exchange related to pulmonary involvement. 2. Fatigue related to chronic inflammation. 3. Risk for infection due to immune dysfunction or corticosteroid use. 4. Anxiety related to the chronic nature of the disease. 5. Ineffective coping related to long-term illness. Management. Medical management. 1. Pharmacological treatment, corticosteroids, prednisone is the first line treatment. Immunosuppressants, methotrexate, azathioprine or mycophenolate. Mefetal. Biological agents, anti-TNF agents like infliximab for refractory cases. 2. Symptomatic management, bronchodilators for respiratory symptoms, antihypertensives, medication for cardiac involvement. 3. Surgical interventions, lung transplantation in advanced pulmonary fibrosis. Nursing management. 1. Monitoring vital signs, oxygen saturation and respiratory status. 2. Education, disease process, medication adherence and symptom recognition. 3. Psychosocial support, address anxiety, depression and coping mechanisms. 4. Nutrition, encourage a balanced diet to combat fatigue. 5. Prevention of complications, regular follow-up for organ function assessment. Treatment. 1. Pharmacotherapy, steroids and immunosuppressants. 2. Oxygen therapy for hypoxemia in advanced disease. 3. Physical therapy, pulmonary rehabilitation to improve exercise tolerance. Psychosocial medicine. 1. Counseling and psychotherapy. 2. Stress management techniques. 3. Support groups. 4. Cognitive behavioral therapy CBT. 5. Patient and family education programs. Prevention. 1. Avoid exposure to environmental and occupational triggers. 2. Maintain a healthy immune system through balanced nutrition. 2. Regular health checkups for early detection. 4. Practice respiratory protection in high risk environments. 5. Limit exposure to infections by practicing good hygiene. 6. Avoid smoking and second-handed smoke. 7. Manage stress to reduce immune dysregulation. In conclusion, sarcoidosis is a multi-factor disease requiring a multidisciplinary approach for optimal management. Early diagnosis and tailored treatment plans are crucial in preventing complications and improving patient outcomes. With ongoing research, the understanding of its pathogenesis and treatment options continues to evolve. Thank you. Have a nice day.